So sometimes patients have persistent positive visual phenomenon of migraine. And this persistent positive visual phenomenon of migraine is a diagnosis of exclusion. Normally when you have migraine aura, it's transient. It lasts 20 minutes. It's often described as a jagged line. It gets bigger over time, which we call march and buildup, moves across your visual field. It's bilateral and simultaneous, and there's colors or flashing lights inside of it, which we call scintillating. This jagged line scotoma is called a fortification scotoma because it looks similar to what a fort would look like if you flew over it with a drone. So forts of old have this kind of configuration to them so that you can generate crossfire. So if you have persistence of your aura, you should scan that because that's very unusual. The migraine aura lasts 20 minutes and is followed by the headache. So we'd like to have the definition of migraine met in any patient with migraine aura, and that's usually a headache that's unilateral or alternating hemicrania, severe, disrupts your activities of daily living, you have to go lie down, and you have 2 of the following 4 autonomic dysfunctions: photophobia, sonophobia, nausea, vomiting. If you have that and have more than 5 episodes, you have migraine. And if you have this scintillating fortification scotoma prior to the headache, this is migraine with aura. However, just like migraine can be status migrainosis, the headache just continues on and on, some people have aura, status of the aura, it just persists. And so you need to work that up, MRI. The other thing that can do it is seizure, so we're going to do EEG. And sometimes it's retinal-based photopsia that's causing it, so we need to work it up for retinal disease as well. You're going to do a visual field, make sure there's no homonymous hemianopsia. If you do all of that and it's negative, then we call that persistent positive visual phenomenon of migraine. It is a diagnosis of exclusion. We used to think that the visual snow people were this, but now we know visual snow is probably something totally separate. However, there is a migraine aura version of this that's persistent. It is a diagnosis of exclusion.